Most people do not think about their eyesight until something begins to change. You may notice that the words on a page no longer look as sharp as they once did. You may need brighter light when reading, or a little more time for your eyes to adjust when you walk into a dark room. Driving at night may feel more tiring. Faces across the room may seem less distinct, and colors may not look quite as vivid as they did years ago. Because these changes often happen slowly, many people simply assume that nothing can be done. They believe weaker vision is an unavoidable part of growing older. Age does affect the eyes, but it is not the whole story. The condition of your blood vessels, your blood sugar, your exposure to sunlight, whether you smoke, the medications you take, and the quality of your daily diet can all influence how well your eyes continue to function. No fruit can cure an eye disease. No food can restore vision that has already been permanently lost. But your eyes are living tissue, and like every other part of the body, they depend on a steady supply of nutrients. When those nutrients are consistently present in the diet, they can support the eye's natural defenses. When they are consistently missing, the tissues inside the eye may become more vulnerable to oxidative stress, poor circulation, and other changes associated with aging. Today, I want to talk about 7 fruits that can make a useful contribution to an eye-supportive diet. Some are familiar, others may not be foods you normally associate with vision. Before we begin, I want to make one thing very clear. If you suddenly lose vision, experience severe eye pain, see flashes of light, notice a sudden increase in floaters, develop double vision, or see what looks like a dark curtain moving across your field of view, do not wait for a dietary change to help. Seek medical attention promptly. Nutrition supports eye health, but it does not replace professional diagnosis or treatment. To understand why these fruits may be helpful, it is useful to understand what happens inside the eye as we age. At the back of the eye is the retina, a thin layer of tissue that receives light and converts it into signals the brain can interpret. At the center of the retina is the macula, the small area responsible for detailed central vision. You depend on the macula when you read, recognize faces, sew, drive, or focus on anything directly in front of you. The retina is highly active. It uses large amounts of oxygen and energy, and it is exposed to light throughout the day. This makes it particularly vulnerable to oxidative stress. Oxidative stress occurs when unstable molecules begin to damage cells and proteins. The body has antioxidant systems that help control this damage, but these systems depend partly on nutrients supplied by food. 2 especially important nutrients are lutein and zeaxanthin. These natural pigments accumulate in the macula, where they help absorb certain wavelengths of light and support the retina's antioxidant defenses. The body cannot produce enough of these compounds on its own. They must come from the diet. The lens of the eye also needs protection. The lens helps focus light, but unlike many tissues in the body, its central cells are not regularly replaced. Damage can accumulate over many years. Oxidation is one source of damage. Glycation is another. Glycation occurs when sugar molecules attach to proteins and alter their structure. Persistently high blood sugar can accelerate this process. This is one reason uncontrolled diabetes can have such serious effects on the eyes. Healthy circulation also matters. The retina is supplied by extremely small blood vessels. Anything that damages blood vessels throughout the body, including high blood pressure, smoking, diabetes, and cardiovascular disease, may also affect the circulation that supports the eyes. This is why eye health cannot be separated from general health. The first fruit worth including is kiwi. Kiwi is an excellent source of vitamin C. Vitamin C is a water-soluble antioxidant that helps protect cells from oxidative damage. The fluids surrounding the lens contain vitamin C, so regular intake contributes to the eye's natural antioxidant environment. Kiwi also contains small amounts of lutein and zeaxanthin. Dark green vegetables provide more of these carotenoids, but kiwi can still be a helpful addition, particularly for people who struggle to eat enough vegetables. 1 kiwi can be added to breakfast, sliced into plain yogurt, or eaten as a simple snack. Combining it with a small source of healthy fat, such as a few nuts or seeds, may help the body absorb its fat-soluble carotenoids. What matters is regularity. Eating kiwi once every few months is unlikely to make a meaningful difference. Including a variety of nutrient-rich foods consistently is what supports the body over time. The second fruit is watermelon. Watermelon is often dismissed as little more than water and sugar, but red watermelon contains lycopene, the pigment responsible for its color. Lycopene belongs to the carotenoid family and acts as an antioxidant. It has been studied for its possible role in protecting tissues from oxidative stress and supporting cardiovascular health. That connection is relevant because healthy blood vessels are essential for delivering oxygen and nutrients to the retina. Watermelon can be a refreshing and hydrating fruit, but portion size matters. A moderate bowl is usually enough. People who monitor their blood sugar should consider watermelon as part of their total carbohydrate intake rather than assuming that unlimited amounts are harmless because it is a natural food. There is also no strong reason to believe that watermelon must be eaten before bed. In fact, eating a large amount late at night may not be a good choice for someone who already wakes frequently to use the bathroom. The best time to eat it is the time that fits comfortably into your routine and allows you to maintain sensible portions. The third fruit is black currant. Black currants have a deep purple color because they are rich in anthocyanins. These are the same family of pigments found in blueberries, blackberries, cherries, and purple grapes. Anthocyanins are antioxidants, and they have been studied for their effects on blood vessel function, inflammation, and oxidative stress. Some research has also examined black currant extracts in relation to visual fatigue and the ability of the eyes to adapt to darkness. These findings are interesting, but they need to be interpreted carefully. A concentrated extract used in a study is not the same as eating a small handful of fruit, and it does not prove that black currants can correct night vision problems. Still, black currants can be a useful part of a varied diet. They provide vitamin C, fiber, and a range of protective plant compounds. Fresh black currants are not widely available everywhere, but frozen fruit may be easier to find. Unsweetened products are preferable to syrups and heavily sweetened juices. Anyone taking a blood thinner should speak with a doctor or a pharmacist before using concentrated black currant supplements. Natural products can still interact with medication. The fourth fruit is wild blueberry. Blueberries are often promoted for brain health, but the retina is also part of the nervous system. The cells that detect light are specialized nerve cells, and they are exposed to many of the same age-related stresses that affect other parts of the nervous system. Wild blueberries usually contain a higher concentration of dark pigments than larger cultivated blueberries. Although both varieties can be nutritious, frozen blueberries are one of the easiest options to use regularly. They can be added to oatmeal, mixed into yogurt, or eaten with a small serving of nuts. Freezing does not remove all of their nutritional value, which means you do not have to wait for fresh berries to be in season. Blueberries are not a treatment for macular degeneration, cataracts, glaucoma, or diabetic eye disease. Their role is more modest and more realistic. They contribute antioxidants, fiber, and plant compounds to a dietary pattern that supports general vascular and cellular health. That may not sound as exciting as a miracle cure, but it is far more honest and far more useful. The fifth fruit is red dragon fruit. Dragon fruit comes in both white-fleshed and red-fleshed varieties. The red variety contains pigments called betalains, including beta-cyanins, which give the fruit its striking color. These compounds have antioxidant properties and are being studied for their possible effects on oxidative stress and metabolism. Red dragon fruit also provides fiber, fluid, and vitamin C. It is sometimes described online as a fruit that can prevent cataracts or stop glycation inside the eye. At this point, those claims are stronger than the evidence. A more accurate way to view red dragon fruit is as one colorful option among many. It can help increase the variety of plant compounds in the diet, but it is not essential and it should not be treated like medicine. If dragon fruit is expensive or difficult to find where you live, there is no reason to worry. Berries, citrus fruits, kiwi, tomatoes, and dark green vegetables can provide many of the nutrients your eyes need. Healthy eating should be practical. It does not require rare or fashionable foods. The sixth fruit is goji berry. Goji berries are especially interesting because they contain zeaxanthin, one of the carotenoids naturally concentrated in the macula. Some human studies have examined whether regular goji berry intake may influence macular pigment and other markers associated with eye health. The research is promising, but goji berries should still be seen as food, not treatment. Dried goji berries can be added to oatmeal, yogurt, or an unsalted mixture of nuts and seeds. Because dried fruit is concentrated, a small serving is usually enough. It is easy to eat much more dried fruit than fresh fruit because the water has been removed. That means the natural sugar and calories are also concentrated into a smaller volume. Read the label carefully and choose products without unnecessary added sugar. Goji berries may interact with warfarin and possibly other medications. Anyone taking blood thinners, diabetes medicine, or blood pressure medicine should speak with a healthcare professional before making goji berries a regular part of the diet. This is an important reminder that natural does not always mean risk-free. The seventh fruit is papaya. Papaya is an excellent source of vitamin C and contains several carotenoids, including beta-cryptoxanthin. Beta-cryptoxanthin can be converted by the body into vitamin A. Vitamin A is essential for the normal visual cycle, especially the process that allows the eyes to function in low-light conditions. Severe vitamin A deficiency is uncommon in many countries, but inadequate intake may still occur in people with very limited diets or conditions that interfere with fat absorption. Papaya can be eaten with breakfast, added to a fruit salad, or served with plain yogurt. A moderate portion provides natural sweetness, fiber, vitamin C, and carotenoids. It is important not to mistake a nutrient's role in normal vision for proof that eating more of that nutrient will correct an existing vision problem. Difficulty seeing at night can be caused by cataracts, retinal disease, glaucoma, medication effects, or an outdated eyeglass prescription. It deserves a proper eye examination. Papaya may support normal nutrition, but it cannot identify or treat the cause of poor night vision. After hearing about these 7 fruits, you may be tempted to choose one and eat it every day while ignoring the rest of your diet. That would miss the larger point. The eyes do not depend on one vitamin, one antioxidant, or one fruit. They require a network of nutrients working together. Dark green vegetables provide lutein and zeaxanthin. Nuts and seeds provide vitamin E and healthy fats. Fish and other appropriate foods can provide omega-3 fatty acids. Eggs provide several nutrients that support eye tissue. Legumes, whole grains, fruits, and vegetables support blood vessel health and blood sugar control. The overall pattern is more important than any individual item. For people with diabetes or prediabetes, controlling blood glucose is one of the most important steps for protecting vision. Adding berries or papaya will not cancel out persistently high blood sugar. For people with high blood pressure, managing that pressure matters because the small blood vessels in the retina can be damaged over time. For smokers, stopping smoking can have a much greater effect on long-term eye health than adding a particular fruit. For anyone with age-related macular degeneration, it may be appropriate to ask an ophthalmologist about the AREDS 2 supplement formula. AREDS 2 is not a general eye vitamin for everyone. It was studied in people with specific stages of macular degeneration. Whether it is appropriate depends on your diagnosis, smoking history, medication use, and overall health. Do not begin high-dose supplements simply because a label says they support vision. More is not always better. High doses can cause side effects, interfere with medications, and create risks that ordinary servings of food do not. At your next eye examination, ask whether there are signs of cataracts, macular degeneration, glaucoma, diabetic retinopathy, or changes in the retinal blood vessels. Ask how often you should have a comprehensive eye examination based on your age and medical history. Ask whether any of your medications may affect your vision or interfere with nutrient absorption, and if you have noticed changes in night vision, reading ability, contrast, or visual comfort, describe them clearly rather than assuming they are simply caused by age. Several eye diseases can develop before they produce obvious symptoms. That is why regular examinations are so important. If you want to improve your diet, begin with a realistic step. Choose 2 or 3 colorful fruits that you enjoy and can afford to buy regularly. Rotate them throughout the week instead of relying on one food. Include more dark green vegetables. Add a small portion of nuts or seeds when appropriate. Eat enough protein. Stay physically active. Keep your blood pressure, cholesterol, and blood sugar under control. Wear sunglasses that block ultraviolet light when you are outdoors. Avoid smoking. Follow the treatment plan provided by your eye doctor. Do not expect your vision to become dramatically sharper after a few weeks of eating fruit. Nutrition is not an instant test that you can measure by reading smaller letters on a page. Its value lies in supporting the body over months and years. A healthy diet helps provide the materials your cells need while reducing some of the metabolic stress that contributes to chronic disease. Kiwi cannot reverse decades of damage. Blueberries cannot replace diabetes treatment. Goji berries cannot cure macular degeneration. Papaya cannot take the place of a comprehensive eye examination, but a balanced diet can work alongside medical care, regular physical activity, healthy circulation, appropriate medication, and early detection. That combination is what protects health most effectively. Your vision is connected to nearly every part of your independence. It helps you read, prepare meals, take medication safely, move around your home, recognize the people you love, and remain connected to the world around you. That is why eye health deserves attention before a serious problem appears. Choose variety rather than perfection. Use whole foods more often than supplements. Be cautious with exaggerated claims. Take sudden symptoms seriously. And continue having your eyes examined even when your vision seems stable. The decisions you make today may feel small, but repeated over time, they become part of the foundation that supports your health. Your eyes have worked for you every day of your life. They deserve that same steady care in return.